I'm absolutely delighted now to be joined by Chris Probert from Liverpool University, who's the inventor of the odour reader. Chris, welcome.
Thank you.
What is the odour reader?
The odour reader is a device that smells and interprets the smell from biological samples. So as a gastroenterologist, we've been looking at diarrhoea, but we've applied this to urology as well by sniffing urine. And so it takes gas from a sample, separates out the compounds in the gas and tells us what the mix is.
And what gave you the inspiration for this?
Frankly, it was dogs. Dogs have been sniffing samples for some time, and one of the first trials ever was dogs sniffing urine for bladder cancer. And we thought if a dog can do it, a machine should be able to be trained to do it, and arguably a machine in the corner of a lab is better than a dog that might get distracted. What
sort of results have you had?
We've had some very exciting results in urology. We've been focusing on bladder cancer, where we have about 96% accuracy. That's a combination of sensitivity and specificity. And we can move our cut point to get better sensitivity or accuracy. Recently, though, we've been looking at prostate cancer as well. And compared with men who've got a biopsy-proven prostate cancer, we're finding the diagnosis in about 90% of men. So we think it's very encouraging and a step up on the PSA testing that many people have been using in the past.
What's the next step for the odour reader?
The next step is two-part. We need to do some larger validation studies and we need a commercial partner so we can get this piece of kit into surgeries and clinics so that men with prostate cancer and everyone with bladder cancer can have a urine test instead of a cystoscopy.
And I would have thought the advantage is not just the accuracy that you've talked about, but also it would seem a cost-effective way of providing this service.
Absolutely. Bladder cancer is one of the most expensive cancers to treat of all of them, even the leukemias. And so the potential for providing a urine sample that will remove the need for a cystoscopy has got to be a significant saving to the NHS, but actually a saving to patients as well. It's not a nice procedure to have done. And if you can have a urine test instead and defer your next cystoscopy for a year or two, that's got to be a good thing.
Chris, thank you very much and best of luck with the future of that.
Thank you very much.